Okay, Mr. Coffman, first I want to thank you for coming here and meeting with us all. We do really appreciate it. You already mentioned it in your opening speech. The gentleman over there mentioned it too about the tort reform. And I'm really glad to hear you say that that's one of the things that you want to work on when you get back there. Is there anything that's being drafted at this time, or is this still a blank slate?
It's a blank slate right now.
And I know it's not in the health bill at all. Have other congressmen and or senators been talking about it or having meetings on it?
There's been a lot of talk about it. Unfortunately, in the Congress of the United States, the process is not like at the state level, where every legislator who introduces a bill has that bill heard. In the Congress of the United States, the committee chairman, the bill's introduced in the committee, it's up to the committee chairman to schedule the bill. There's not been one Republican health care related bill heard in the Congress of the United States. Okay, can we talk now? Yes.
Congressman Coffman, thank you very much for having this town hall. My question for you is, you've expressed concern that health care reform is going to lead to rationing of health care. Well, I'm sure it's unintentional. The statement is misleading because it ignores the fact that most people's health care is already being rationed by their insurance companies. Nevertheless, we have spent a fair amount of time analyzing the various proposed bills in hopes of finding such reference to healthcare rationing. Unfortunately, we haven't been successful at this point. So can you please tell us tonight which House bill provision proposed by the Democrats contains the stated language which supports your claim that healthcare will be rationed?
The mere statement in the legislation of the House by the President that this legislation will be budget neutral, and that we will get cuts, that there are cuts that can occur out of Medicare to support it, without defining what that really is. And so, do we know right now? The answer is no. And so, what I would like to see is that let's go ahead, and then if the President and members of Congress feel that Medicare is inefficient, and we can take money from that and put it in to support this public option, then let's go ahead and then realize those savings now in seeing whether or not rationing does occur. But to say trust me and then go forward and leave it to a group of bureaucrats to decide is the wrong way to go. You're passing? Okay. Bob, hold on. You gonna microphone?
There have been suggestions for options that include the ability of we as citizens to make choices. One of the things that I've seen discussed recently by some pretty apparently smart people is a cost savings program for medical, which would be a tax deductible thing, but which would bypass the normal insurance, but would approximate the cost of a moderate one. But where it's been tried, the results I've seen are that people ration themselves. They don't use as much, or even try to use as much, as is the case with straightforward insurance or with the government programs like Medicare or Medicaid. If you have any comment on that, I'd appreciate it.
No, I think that one thing I think that we lack in the United States that we look at more as a method of containing costs and I think improving the quality of healthcare is, I think there are a couple of things. I think one is having primary care is more of a foundation of the system, and having a gatekeeper to do that before one goes to a higher price specialist. I think that's a positive aspect of a healthcare system. And I think if we look at the cost of healthcare, I don't want to look at too many people out here, but the rise in the cost of healthcare is a lot of it's due to our own conduct. And one thing that we need is to allow wellness as an aspect of health insurance to be able to have incentives of that. That's not in the public option. And that's something that we ought to have in the system. Okay, Todd Matta? Is it Todd Matta? Did we already, what's that? They already went, I'm sorry. Cindy, S-W-E-A-T-T?
I don't mean to be, is this on? I don't mean to be repetitive, but I do have a question. You know, I have my own children just graduated from college, and there's no jobs for them. I mean, they have little jobs, but they're the jobs that have no health insurance coverage. So they're just winging it and hoping they stay as healthy as they have been. My son, we first tried to get him on a policy, too tall for his body weight. Healthy kid, those kind of you know, things that you have ahead. My knee swells, especially like when I'm standing at meetings for a long time. I got turned down, so I had to go to another insurance company. Covers nothing, no colonoscopy. My dad died of colon cancer. And I'm wondering, because my husband maybe makes enough money that I can still afford my policy, I just can't think my coworkers can afford it. And I'm not poor enough to get Medicaid, not quite old enough to get Medicare, and yet what are people like I'm going to do if you deny them the public option? And I really truly disagree, and I have read the bill very intensely, and I do not believe a public option is going to make people, I think there's, at least the version I read, because you know there's a new one every other day, that you know as they keep changing it and correcting, which is the American way. We do need to improve it and make sure that it covers everyone, but you know, I don't think all these businesses are going to go, well, screw you and go on the public option and now I'm going to save a bunch of money. I mean, they have 8% tax they'll have to pay. So it's like, what about all the people that are really not being able to afford their health insurance, yet they're not going to go to all these services that people are saying are available?
There is